that basically says, though it's not clear how it's going to be done, that anybody who has, or I think could have had, coverage under COBRA will be able to keep that coverage until this new system comes into effect.
Now, the new system is not scheduled to come into effect until the year 2013. This is not about to happen, right? Which is, by the way, after the next presidential election, please note. And if you think that's a coincidence, I'd like you to ride in my dirigible from Berlin to Hoboken, New Jersey. However, if the bill were to pass, your sister and other people like her would be eligible to get coverage under the public option. And if they didn't have the income to purchase it, the income would be provided to them. The problem basically is that there's an organization called Families USA, some of you may have heard of it, did a wonderful study using US Census data that found that in 2007 and 2008, 84 million Americans, that's 1 in 3 under the age of 65, lacked health care insurance in this country for 9 months or more. So the real number is not 46 million. That's the number who don't have it at any one time. But that group is not static. People get it, people lose it. So that's what the economist would call a stock, meaning the amount you have at any one time, not a flow, the number of people that are passing through it. So the real number is that about 1 in 3 Americans either does not have health insurance or does not have it securely enough to provide them with coverage. And that's the real shame in this country. The bill, if it passes, H.R. 3200, and if it has a strong public option, neither one of which are certain at the moment, would make your sister eligible for health insurance.
I want you just to address it for me and make sure I understand it so I can tell my sister what she can do to try and help her cause and the others like her. She's lost her job since last year and was unable to purchase that $500 a month COBRA plan for insurance, for health care. So she doesn't have insurance to this day. What is the bill, or is it anything we address for those people like that that's happened to? This has been several months.